Hello, everyone, and welcome to my PowerPoint, Hepatitis C. My name is Teresa Mason, and I hope you enjoy it. So, what is hepatitis C? Hepatitis C is a virus that affects the liver, and it can cause your liver to become inflamed, which in turn causes your immune system to attack your liver cells. This is what hepatitis C looks like. On the left is a normal liver, and on the right is a liver that has been infected by hepatitis C. Your personal protective equipment would be eyewear, mask, face shields to prevent blood from splashing into your nose, mouth, or eyes. So, what are the symptoms? Most people don't even have a symptom, but those that do are tired and or depressed. How is it spread? It's commonly spread by sharing needles, or you can be born into it because your mom had it and you passed through the vagina and contracted it. The less common ways to spread is through razors, toothbrushes, and sex, uh, or you can get it from an unprofessional person that does tattoos. But you cannot get it through water, eating off somebody else's spoon, a hug and kiss and holding hands, coughing, or sneezing. Who should get tested? Anybody born between 1945 and 1965, those that have used drugs or snorted drugs, unlicensed tattoo shops, such as your cousin down in his basement because he came from the penitentiary and he know what he's doing. Not smart. Anybody that received a blood transfusion before 1987 or got an organ transplant before 1992. Anyone going through dialysis, anybody that went to jail, I'm sure they mean that had body piercings, anyone that was HIV positive, a mother that's had hepatitis C, and wherever you work where they use needles or any type of sharp instrument. So, what tests are used to detect Hep C? There's an antibody test and then there's a RN test. The antibody test can tell if you've ever been infected with the virus, and the RNA test can tell if you currently have it. So, what is cirrhosis of the liver? Chronic hepatitis C, which is called cirrhosis, in patients usually just is when the scarring tissue starts to replace healthy tissues. Like when I showed you the two livers, that scarring is known as cirrhosis of the liver. This can be a slow process, and you may not feel symptoms for years. And by the time you do, the damage will have taken place. Some of the signs of cirrhosis of the liver are red palms, spider-like veins on your face, and sometimes you may look at an older person and say, golly, they got a big stomach but a small body. Sometimes that large stomach is fluid in the abdomen, and they kind of, especially in men, they look pregnant. But if they drink a lot, that's usually or a probable cause of why they like that. Well, approximately 10 to 20% of the people develop it, and it takes a 20 to 30-year period before it starts to bother them. But usually, if you go to your doctor, they'll determine what treatment or option is best to help you feel better or get cured. So, when you look at Hep C on the chronic side, is when the infection is a long term or it has lasted at least 6 months. About 75 to 85% of people who get this infection of Hep C develop it to the point it becomes chronic, and it usually lasts them a lifetime. So, what does it mean if you're cured? Pretty much, Cured means that it's no longer detectable in your blood within 3 months after your first treatment. And then 12 weeks after you've completed your treatment, your doctor will do a blood test to determine if the Hep C virus can still be detected. The reason that I chose to do this PowerPoint on hepatitis C is because I'm familiar with it. This is my husband, and he was Heinz VA 100,000 veteran to receive treatment. And on April 2nd, 2018, he was cleared of having it, meaning he was cured. There is a possibility that he could get it again if he go back to his bad habits. And with that being said, he won't. But I just wanted to say you all stay safe. Uh, those that are out and about, wear your masks. Those that are in the healthcare field, wear your personal protective equipment. Hi, Miss Blake, and may God bless you all. I hope we all pass that test, the final. Have a good one. Bye bye.